Hello everyone, this is Dr. Mansi from Homeopathy 360 and we are back again with another session on another day, and today we are very happy to have one and only Dr. Kavita Chandak ma'am with us on this platform, and today we are going to learn lot of things and we are very eager to start this session. So we have Dr. Chandak ma'am with us. She is a gold medalist scholar in homeopathy and she is practicing since 2 decades in Nagpur. And she is an international faculty invited by 30 plus countries to deliver seminars. Honored by holding Golden Book World Record for treating kidney disorders, she is an advisory board member at Turkey. She is running a NGO, Padmaja Welfare Foundation, which is dedicated in the field of health and rehabilitation. She has published various publications at national and international levels and has achieved various awards. We are very inspired by Dr. Kavita Chandak ma'am. We are going to have a session with her. So let's start.
Thank you, Mansi. Thank you for the introduction. And now, I guess without wasting time, we should start our session.
Yes, ma'am. Yes, ma'am. Sure.
My dear friends, let us start about talking the topic, imagine possibilities without limits. Of course, sky is not the limit for a homeopath. If you have skills, if you have a proper study of organelle, no disease is difficult to solve. The only issue is that we usually get scared with the big names of the diseases. I'll show you how it happens. You see, today I will talk about this neurological disorder and musculoskeletal disorder. And the people who always join my webinars till now, they must be knowing that my sessions are usually interactive sessions. So I keep on asking many questions, and I also want you to ask me many questions. So my first question for the participant is, what is neurological disorder and what is musculoskeletal disorder? You can open your mic or you can type in the chat. Yes. Okay.
Like Shruti has said, when nervous system is involved,
Right.
Tapan Pandya is also said, neurological disorder related to neurons. Dr. Amit Kumar has said, insanity.
Okay. He's giving the example. I'm just asking the definition. Okay. Anybody else regarding musculoskeletal disorders? Okay, no problem. Let me explain you in detail. Neurological disorders are medically defined as disorders that affect the brain as well as the nerves found throughout the human body and the spinal cord. Structural, biochemical, or electrical abnormalities in the brain, spinal cord, or other nerves can result in a range of symptoms. And at the same time, musculoskeletal disorder means this condition usually affect joints such as osteoarthritis, rheumatoid arthritis we get, psoriatic arthritis, gout, and spondyloarthritis. Musculoskeletal conditions usually affect bones such as osteoporosis, osteopenia, and associated fragility fractures, traumatic fractures. So these are few examples of musculoskeletal disorder. And of course, we have muscle pain that we call as a sacropenia if it is associated with sacrum bone. Usually, we patient complains that, doctor, I have pain in my lumbar region, in my sacral region. So all the time pain is not due to muscular disorder only. Sometimes it is because of muscle and skeleton, both, like muscle and bone. Then we call it as sacropenia, right? So this is the small definition and introduction about neurological disorder and musculoskeletal disorder. Now, I'm going to share a case about a victory of homeopathy in a complex case of cerebral atrophy and internet hazard. It is quite complex case because patient came with multiple diagnoses and a very well-known surgeon from my city shared this case with me. He referred this patient to me. In July 2021, a young man aged 37 years consulted me with the diagnosis of diffuse cerebral atrophy His MRI brain screening showed mild prominence, cerebral folia, suggestive of, sorry, suggestive of diffuse cerebral atrophy slash degeneration. You see, there were two diagnoses. One is diffuse cerebral atrophy and degeneration. We have to pay attention to every minute word and to every minute change in the patient. Why? Because we have to address miasm. And for miasm, we need proper study of the remedies as well as the proper study of the patient. So this is the result, the MRI brain screening. You can see the report here. He said, 8 years back, doctors diagnosed me as having degenerative changes in L5S1 and 2 years back with cerebral atrophy. So old complaint was about backache and atrophy was the new complaint, new symptom. I have difficulty walking like imbalance and backache. My speech is not clear. I fumble. I have thyroidism for 3 years. Nowadays, I feel terrible. For 2 years, I have passed tools but have an unsatisfied feeling. So basically, the complaint about constipation. I have sensitive throat to sour or cold food since my higher school days. My father had same degenerative changes in back. He was operated for that. Mother has asthma. I am sitting for long time in my office and using laptop and Wi-Fi. So this is the picture of the person about his life investigation, life space, and his work. He further said, Doctor, I'm quite introvert person. I'm not able to open up with everyone. I keep everything inside me. By profession, I'm chartered accountant. Please help me in solving my issue. I asked him to add some more symptoms if he has any, because there were so many remedies knocked my brain till now, but I was not able to find out a particular remedy for the person. He said, in my old job, we did not have toilet in our office. I had to hold urine for a long time. It was 1 year back. Now I switched my job. I asked him whether he switched the job for this reason only or he had some other problems. He answered, the working hours were too long and it was annoying to sit with computer for such a long time. I was fed up with this monotonous routine, hence I changed the company. He changed the company, but the pattern of work was same. Now I have flexible working hours, toilet facility, and less stress. The job is same, still working on computer. I feel heaviness in eyelids and head, and there is drowsy feeling while talking. My vision is blurred. I feel exhausted and my stamina is not good. So I guess now you know the remedy. If anybody knows the remedy, please answer. I'm waiting. Yes, Dr. Bansi. Somebody answered, yes, Dr. Aditya, you are correct. The remedy is gelsemium. I also felt that this remedy is gelsemium. But, homeopathy is not so easy. And if it is so easy, then it won't be homeopathy. So there is a twist. What could be the analysis in this case? First step of every case is case taking. Second step is do analysis, do evaluation. And third step is compile your rubrics. So what could be the analysis in this case? During the interview, I observed that degeneration is the keynote of this case, running right from the spine to the liver and to brain. All other symptoms like heaviness in the eyes and head, blurred vision, difficulty speaking, imbalance while walking, etc., etc., are the secondary manifestation of the primary degenerative changes. So, what was my cup of tea in this case? It was the degenerative changes in the body. His MRI cervical spine with spinogram study showed degeneration at L5S1 with annular tear. Annular tear was also present there. And you see, usually annular tear is not curable, not preventable even. And in allopathy, they use some steroids, some anti-inflammatory or analgesic injections along with the tractions for annular tear. Still, they are not able to heal it. Additionally, he has acute cholecystitis, diffuse fatty infiltration of liver, and grossly distended gallbladder. All reports of the patient are here. See here, grossly distended gallbladder and no other significant abnormality is seen in his whole abdomen, as per this mention. But in the other report, if you will see, this is the MRI. It shows acute cholecystitis with diffuse fatty infiltration of liver of the same patient. And all investigations were done in July. This report is from 15 July and this report is from 12 July. I decided to compile few rubrics here. So I took the rubric mind reserved, brain atrophy, heaviness in the head, heaviness in the eyes accompanied by heaviness in the head. Then heaviness in the lids from the chapter eye, mouth, speech difficult. He said my speech is fumbling. You know, doctor, when I talk, I fumble. But actually, there is no stuttering or stammering. He is only fumbling because of the degenerative changes going on in his brain. Then I considered the rubric fatty degeneration of liver in abdomen, spinal cord complaints of spine from the chapter back, spinal cord degeneration again from the chapter back, and from the chapter general, I considered the rubric tendency to degeneration of tissues and organs fatty degeneration. Now many remedies came up as usual. You see, when you put all the rubrics in repertory, repertory has no other work to confuse you with lot of medicine. So I got the remedies phosphorus, lycopodium, plumbum gelsemium, naxomica, aurum conium mag, mercury salt, agaricus, as well picric acid. So now please tell me how to handle this. Which remedy should I suggest here to my patient and in which potency? Yes. Potency, yes. Oh, Rajni, am I audible now? Citric acid, very nice answer, Hetal. Dr. Faisal, there is a rule about case taking that we should not ask the leading question. So just go with the flow. Let patient talk first. Then if you have any queries, you can ask him. But do not allow him to answer the leading questions like he can answer in yes or no. For example, when we ask, do you like sweets? Patient says yes, or he can say no. Now, how to differentiate between this symptom, desire for sweet, whether it is physical general or mental general? So ask the patient, what about desserts? Do you like desserts? He will say yes. And you can see this sparkling light in his eyes. When he says, yes, I'm crazy for desserts, it is a mental general. When patient says, yes, doctor, I like desserts, if you will keep 5 flavors, I'll first, take desserts. I'll first choose sweet. Then it is physical general. So the way how you ask the question can also differentiate your question, whether it could be physical general or mental general. And it will give you the perfect repertorization, which will ultimately give you the perfect remedy. I usually do not go with the marks of the remedies first. First, I go with the mathematics of the remedy. And then I decide, okay, sometimes I prescribe the remedy which can stand in my repertory chart on the 58th number. So how to answer this here? Whatever there is generation, whenever there is generation, we usually think about phosphorus. And coincidentally, in this case, phosphorus came in first place in the repertory chart. I did not prescribe phosphorus. It covers degeneration and fatty infiltration of the liver, but it does not cover degeneration of spinal cord as well the tissues. It is good for organ degeneration. So I did not prescribe phosphorus. Now, which remedy I prescribed? I gave him Vanadium Med 30 twice a day for 15 days. High Vanadium. You see, I focused on two important symptoms in this case. First is fatty degeneration in organs and tendency of degeneration in the tissues. And that's why I got two remedies, arsenic album as well vanadium. Vanadium, it is a very hard silvery gray colored metal. Initially, it is called as brown lead, later named it as a vanadium. Metals are obtained from mineral kingdom. Many wonderful remedies are prepared by potentizing the metals. Metals have direct action on human physiognomy. They affect almost every vital system of body. Metals are also used as therapeutic agent. Vanadium is present at the center part of the left side on the top rows. Fourth row, fifth column in periodic table. And this remedy is proved by Burnett. Its sphere of action is mostly circulatory system and all types of mucous membrane. And its clinical indications are Addison's disease, anemia, arteriosclerosis, atheroma, emaciation, fatty heart, liver disorder, and malnutrition. By the way, which is the wonderful remedy in homeopathy for emaciation? Abrotanum is the correct answer. Yes, abrotanum and borax are the wonderful remedy for the emaciation. What is the keynote of abrotanum emaciation, Shruti? Yes, there is emaciation of the lower part of the body. Thank you so much. I am happy that we are conducting an interactive session. Now, next, let me tell you something about vanadium. Vanadium people have to be successful, but they are not allowed or they are incapable. They oblige to live up to many tasks, but they are confused as to what task, why, and how to do. They don't really know what they want. They make plans, but they think I won't succeed anyway. They feel that they have to achieve a lot in their position, but they are not sure what. They do not know what to achieve, but they want to achieve. They are always doubting themselves, irresolution is there, and can't make choices. What is the best remedy when you have irresolution in the big choices of the life? Like choice for the marriage, choice for buying a very precious or expensive house, like big choices of life, which is the best remedy for this irresolution. Uh, Alumina, okay, fine. But there is only one remedy mentioned in Matra Medica about irresolution in the big choices of life. And that remedy is DNA. I repeat, the name of remedy is DNA. Am I choosing, they are always very much confused about themselves. They are not strong enough to make decisions. And if they do make one, they doubt their choice afterwards. Am I choosing the right profession? Am I a good person? Who am I? The doubt is a result of their fear of failure. The theme comes up in their dreams too. They dream of missing the train, of not getting to the telephone on time, etc., etc. Their continuous doubting attitude is the reason that they don't complete things and they are always late. There is a Hindi song in the movie of Rishi Kapoor, Hina, मैं देर करता नहीं देर हो जाती है. Why didn't he consult me? I could have treated him with the remedy Vanadium. Few further symptoms about Vanadium here are the cause of this situation can usually be found in their upbringing. There is often successful and dominant father. They are brought up very strictly with the task of pleasing everybody, particularly their own parents. In which other remedy we get such childhood? Aditya, which topic you want me to repeat, please? About the remedy. This remedy is DNA. It is about the irresolution in the big choices of life. DNA, deoxyribose nucleic acid. Yes, Shruti, carcinosin is correct answer for the second question. My question was that in which remedy we get dominating father? One is carcinosin, second is nitramur, third is folliculina. And that's why you will see the nitramur child always try to please others. And this becomes the habit. And this is why they become introvert in their life and they keep on pleasing, they keep on seducing others all the time. Just to listen good words, appreciation from them. Vanadium people have to be good, caring, decent, and hardworking children. Such a child won't dare to resist their regime and eventually won't know anymore what it wants for itself. It feels obliged to its duties, but do not know the reason and purpose anymore. You see, they keep on following their duties, they keep on fulfilling their duties, even without knowing the purpose of the duty. Just because now it is a part of the habit. Which are other 2-3 dutiful people in Matra Medica? Uh, I don't know why somebody has written here why it's not audible, but otherwise everybody is answering. I guess they are able to listen me. Aurum is the correct answer, Aditya Raj. Yes, Aurum is very dutiful. And 2 other remedies which are quite dutiful, like Aurum. I asked the question, Aditi, about which are the other dutiful patient in Matra Medica than carcinosin. Naxvomica is fastidious, perfectionist, but not so much beautiful. Somebody has answered Aurum. Aurum is correct answer. Platina is beautiful to herself only, not for others. Other remedies which are having a strong sense of duty are sepia and apismel. Vanadium was working well. So, sorry, I was talking about vanadium. Yes. Now, some characteristic symptoms of vanadium remedy is it is a very good remedy for degenerative condition of liver and arteries. Acts as a tonic of digestive functions in early tuberculosis. Sensation as if heart was compressed, as if blood had no room in the aorta, anxious pressure on whole chest all the time. They have fatty heart, brain softening is there, tuberculosis is there, cough is dry, irritating and paroxysmal, sometimes with hemorrhage, anorexia and symptoms of gastrointestinal irritation, irritation of nose, eyes and throat, and anemia is there. Arteriosclerosis is very common in vanadium. Now let me talk something about arsenic album because it was the closest differential remedy to the vanadium in this case. Arsenic has fatty degeneration of heart and angina pectoris. Pulse is more rapid in the morning. Liver and spleen enlarged and painful ascites and anasarca is there. That's why we usually use arsenic album as an emergency remedy when there is water retention in chronic kidney disorder along with apismel. Phosphorus is some other remedy good for degeneration. It is very weak and this patient is very weak and having all bone sensation. Liver is congested, acute hepatitis is there, fatty degeneration is there, heart having violent palpitation, anxiety on lying on left side and right side of heart is dilated and feeling of warmth in the heart is there. Now you can see the follow-up after 15 days. I don't know why I was not able to share the sound when you share the screen. But I guess you can read this from the subtitles because these videos are not present currently in my folder. Otherwise, let me try and share my screen again. Let me do that 1 second for you. Still not able to share the volume. I don't know why. But I guess it will work.
15 दिन पहले मेडिसिन डाली थी सेरेब्रल एटमॉस्फेयर पे, ठीक है? तो ये 15 दिन में मेडिसिन से कोई तकलीफ हुआ आपको? तो आपने मेडिसिन मतलब कि अगर परसेंटेज इंप्रूवमेंट दिखा है, क्या इंप्रूवमेंट दिखा 15 दिन पहले चलता मेरा इम्बैलेंस? अच्छा, मैं बताऊं अगर डायबिटीज होता है और पानी को डाइट आप 2 बार वॉक को जा रहे हैं तो पहले इतनी देर टाइम पा रहे हैं क्या? 15 दिन के पहले आप कितना वॉक कर रहे थे? अच्छा, और अभी और डर नहीं लगता कि मैं गिरूंगा? एकदम कॉन्फिडेंट। ओके, थोड़ा सा हो सकता है। भैया वर्टिगो का क्या पोजीशन है? एक कंप्लेंट आपका था भैया कि आंखें अपने आप आपकी पलकी गिर रही थी, टोसिस कम हुआ है, पर अभी आंखों में क्या हो रहा है फिर? जरूर हो रही काफी। हाँ, और बस विजन जो थोड़ा सा है और स्पीच ब्लर हो रही, बैक पेन है, ओके, और एसिडिटी हो रही है, ओके, मेरा कॉन्फिडेंस बूस्ट होना लगता है, वो भी अभी बूस्ट हुआ। वेरी गुड, वेरी गुड। तो अभी क्या ना कि पहले से थोड़ा ज्यादा एनर्जेटिक भी फील कर रहा हूँ। वेरी गुड। अभी मैं चलो बहुत
और
बढ़िया।
एट प्रेजेंट में कोई भी दवाई नहीं है, इसके सिवा कोई दवाई नहीं।
वेरी गुड।
Was it audible to all of you, the video? Thank God, it's audible. Okay. So now, proceeding with further medication. Now, patient is here after 15 days. I just repeat Vanadium 30, given twice a day for 30 days again, because it was working well. And usually we should not change the medicine when it is working. Now see the follow-up after 45 days.
अभी कैसे भी आप?
अभी ठीक है, अभी है ज्यादा चलने में थोड़ा दिक्कत।
अच्छा,
और थोड़ा सा
सर थोड़ा अभी भी आपने को 1.5 महीना हो गया दवाई शुरू करके आपका, है ना? Because we started at 20 July 2021 and today is 9th September. So how much improvement you observe?
improvement अगर मैं कहूँ क्या 60% के around।
Okay, thank you.
It was strange for me. He was 50% better in first follow-up just after 15 days of first medicine. And now, after 45 days, he is saying total 60% improvement. Vanadium was working well, but something was there which was not letting Vanadium to work in full strength. This is what we call as obstacle to recovery. I understood that I must address it, and that's why I decided to take the case again. The recase taking was done. Patient said, I feel muscular weakness. There is occasional heaviness in the lids. I feel pain in upper part of eyebrows. All these symptoms started with my last job, where I used to sit for long hours working on computer. I used to read articles on phone for 2 to 3 hours daily. Now I reduced the reading time, but still using mobile phone to surf social media. Due to COVID lockdown, I started playing games on tab and phone. I changed the job now, but my work is still same. Hanuman mentioned about exciting and maintaining cause in aphorism 7. He wrote, we need to remove this obstacle to recovery to achieve the cure. For his muscular pain and headache, I was thinking gelsemium. But what about the excessive exposure to electromagnetic radiation? It is also responsible for headaches and eye symptoms. He was constantly under Wi-Fi for years at his working place and at the home. Although there is very little established scientific evidence of adverse health effect from the Wi-Fi radiation exposure, but a homeopath knows how our energetic fields get disease. Everything can affect our energy, which is the originality, which is the technicality, what homeopathy considers. The other branches of medicine do not pay attention to the energetic disorder or toxins in the energy level. Toxic substance can leave an energetic imprint that lasts even after the material substance is no longer present, especially after long-term exposure to toxin. Here, Wi-Fi is the toxin. Ultimately, radiation and foreign body has provoked an energetic imprint in the energetic system, in the vital energy of the patient. So I considered it as a modern era miasm. Like we have pollution, we have 5G, all these things are the modern era miasm. You see, Hanuman was so fortunate because in this era, there were no pollution, no 5G. And there was no stressful life. But today's modern era gave us a lot of comforts, no doubt, with a package of lot of diseases producing immunity brokers. With every modern high-tech device, we get hidden adverse effect, as we get lot of side effects or adverse effect with the vaccination, which is so-called given for increasing the immunity. But all the time, is it the same scenario with all patients? Definitely not. There is a study performed which said that Wi-Fi study shows that Wi-Fi causes oxidative stress, and this oxidative stress ultimately can create chronic degenerative disorders in our body. You see, Wi-Fi do not directly affect our body, but it may create oxidative stress, it may increase oxidative stress, which in turn can create chronic degenerative disorder in our personality. Here, either two remedies knock my brain at this moment. One was electromagnetic radiation remedy, which counteracts the ill effects of radiation. I repeat, electromagnetic radiation remedy, which can counteract the ill effects of radiation from computers, cell phones, television sets, power lines, household appliances, etc., etc. Or the other remedy which knocked my brain was Wi-Fi radiation remedy, and I was actually looking for these two remedies in this case. I prescribed Wi-Fi radiation remedy 10 mg 1 aqua dose because that time it was available in my stock. These remedies are not proved traditionally by simply reading the well-documented effects and adverse reactions of the drug in question. We have a comprehensive set of symptoms for each medication. Effects have been well studied and the medications have been used by humans on a large scale. And this remedy you get, Helios company in UK prepared this remedy. Now, after the remedy, you will get to see the follow-up after 60 days.
भैया आज 23 सितंबर है, अभी स्पीच कितना इम्प्रूव हुआ है?
पहले पूरा 5 दिन पे ही फंबल होता था, इससे होता था तो बचेगा। अभी मेरा 10-15 मिनट तक की कोई फंबल।
वेरी गुड,
मुझे बात है,
बहुत ही बढ़िया। और
ये आपको एक्सप्लेन समझ रहा हूँ।
हाँ, यस। सो अभी होम्योपैथी में ट्रस्ट है?
110%।
अच्छा, और फिर चक्कर अभी कैसे आप?
अभी इम्प्रूवमेंट है। अभी पहले जो मैं वॉक करता था, कॉन्फिडेंस नहीं था, अच्छा कॉन्फिडेंस है, हर चीज कर लेता हूँ।
अच्छा, अपन एक करेंगे भी आपका ब्रेन का वापस से एमआरआई, लेकिन इतनी जल्दी 1.5 महीने में हम एनाटॉमिकल चेंजेस नहीं दिखा सकते सेरेब्रल एट्रोफी में, वे भी आगे भी ना दिखा पाए, लेकिन एटलीस्ट फंक्शनल चेंजेस आपकी बॉडी में आने शुरू हो गए, तो अपना लाइफ तो ठीक होना शुरू हो गया। थैंक यू, थैंक यू सो मच डियर, थैंक्स टू होम्योपैथी।
Now, what should be the prescription at this moment? Patient is doing well. Should I prescribe the same remedy? Should I change the remedy? Or should I go with placebo? This is said to wait and Tapan said to placebo. Okay, thank you so much. Yes, anybody else? Hetal also said placebo. Okay. I just prescribe or I just repeat the same remedy, Wi-Fi radiation 10 mg 1 aqua dose. As things were better, I thought to continue the same remedy and the dose was given in water, aqua. You know, when you want to repeat any remedy, just to increase the speed or speedy the recovery, just put the same remedy in 20 ml of water, stir it well and give the patient to drink at once only. That's all. This is my aqua dose. Now see the follow-up in 2021 November after 120 days.
मतलब मेरे स्पीच क्लियर नहीं आता, अभी आपको दिख रहा होगा कि मैं एकदम फ्लुएंटली अच्छे से बात कर रहा हूँ, मतलब ये बहुत शॉर्ट हो गया है, 70% क्लियर हो गया। कॉन्सेंट्रेशन।
वेरी गुड।
और यहाँ तक कि मेरे को लगता है मैम, जो आपकी मेडिटेशन होती है इससे ब्रेन वगैरह का जो भी मेरा इशू था वो भी सॉर्ट हो रहा है। अभी इससे मेरे को बैक पेन का इशू लगता है।
So right now, backache was his major concern. He was fine, but all the time worried about backache. Obviously, because backache was the oldest symptom, he was suffering from backache for 8 years. Speech, balancing, and vision issues are already settled. Hence, I decided to put the remedy on the tendency of degeneration. With Wi-Fi radiation remedy, I tried to detox the adverse effects of Wi-Fi radiation and internet use from his vitality. Now, my need was a remedy which can arrest the tendency of degeneration. You see, sometimes we start with an appropriate medicine, but if you put quality seeds in dirty soil, it won't turn up in a healthy plant. So, doesn't matter how appropriate your remedy is, it won't give you the result unless and until you are not going to prevent or you are not going to remove the maintaining cause or the positive factor. For example, if you are treating a patient for asthma and you are giving the best remedies, still your patient is not responding well to any remedy. Why? Just because he is living in a damp house. There is no sunlight. So you ultimately need to advise them that please make some changes in your house so that either you will get good sunlight or good air or you can change your house like that. This is the maintaining cause which we have to remove because they work as an obstacle to recovery. So here I again put vanadium mate, this time in 200 potency, one dose every 15 days for 2 months. One dose every 15 days for 2 months means total 4 doses in 2 months, right? Now see follow up in the February 2022. This is the MRI brain. As you can read here, MRI brain study reveals diffuse cerebral atrophy. Where is the word degeneration? Because in the beginning, I told you, in this case, my keynote or what to be treated in this case was degeneration. My cup of tea was degeneration because you cannot change atrophy. It is an irreversible change. But yes, degeneration can be converted into regeneration. So in this report, there is no word degeneration. You can compare these two reports before the treatment, after the treatment. Atrophy reduces the size of the cell under consideration while conserving its form. Degeneration either eliminates the cell completely or so alters its form that its specific degeneration or specific differentiation is no longer recognizable. That's why it is important to remove or to cure degeneration in any case when you have degeneration as keynote. Now see the report or listen our patient.
भैया आज का आपका जो रिपोर्ट देखा है ना ब्रेन का अपन ने, इसमें सेरेब्रल एट्रोफी तो बता ही रहा क्योंकि एट्रोफी इज इरिवर्सिबल चेंज, तो उसको हम बदल नहीं सकते, लेकिन फंक्शनली ब्रेन का अपन ने इम्प्रूवमेंट किया है होम्योपैथी मेडिसिन ने, लेकिन उसके अलावा आपका फंक्शनिंग कैसे बदला?
मैम देखिए, अब ये तो रिपोर्ट एक जो बोल रही है वो अलग बात है, बट मेरे को पर्सनली ऐसा फील होता है कि मैं अभी पहले से ज्यादा अच्छा फील कर रहा हूँ। मेरे को बहुत सी तकलीफ जो पहले थी बिफोर कमिंग टू योर क्लिनिक, मेरे को जो तकलीफ थी अभी बहुत कम हो रही है ऐसा लगता है।
भैया हम जब मिले हैं 28 जुलाई 2021 को और अभी ऑलमोस्ट 24 फरवरी 2022 चल रहा, तो इट इज ऑलमोस्ट 6 मंथ्स। तो ये 6 मंथ में हाउ मच रिकवरी यू गॉट विद आवर मेडिसिन?
काफी इम्प्रूवमेंट है मेरे में।
ओके चलो, थैंक यू सो मच, आपने ट्रस्ट किया, थैंक यू।
This is MRI cervical spine with spinogram. Read it carefully if you can, because I can't read so small letters. But yes, one word is missing here. That is annular tear. See the comparison. This is the first report. This is the last report. And if you will see here in the first report, in the fourth line from bottom, annular tear word was there. And if you will read this report, you will see suggestive of spondylitic changes, but no annular tear is there. You see, annular tear, they say that it is difficult to treat annular tear, almost impossible. But homeopathy treated it without touching the patient. We have few more remedies. If there is a rubric like love for computer, desire to play Nintendo, desire to play Scrabble, because when the software was designed, only these games were in existence. But you can consider this rubric: desire playing, mind playing, desire to play Nintendo or Scrabble for any type of computer game, even for the PUBG. And we all know that these all addictions are basically come under syphilitic mindset. But yes, from this rubrics, we have few medicines there, and you will amazed to know the names of the remedies. These are silicia, buforana, sulfur, and acid salt. I repeat, silicia, buforana, sulfur, and acid salt for law for computer. If there is addiction of the screen, you can choose the remedy among these. But this is ultimately indicative remedies. My suggestion is that just add this indicative symptom to the whole totality of the picture and then choose your remedy. Now, what should be the strategy to deal with neurological cases? How to handle such cases? Because when you have lot of things like internet hazard, degenerative changes in the back, cholelithiasis, cholecystitis, thickening of the walls of the bladder with infiltration of liver, like that, we usually get scared with big names. There is no need to get scared because we are not going to treat the diseases. We are going to treat the person in the disease. So we are targeting the immunity. Now, how to deal the neurological or musculoskeletal cases? Is there any specific strategy for better results? Yes. First of all, you need to pay attention to the keynote symptom. What is the keynote symptom of the case? In this case, degenerative changes were the keynote symptom. Then remove the maintaining or exciting cause. In this case, the exciting cause or the maintaining cause or the obstacle to recovery was Wi-Fi radiation. See, you cannot say the patient that stop using Wi-Fi. I also cannot stop using Wi-Fi. So how can you suggest to anybody else? So it's better to make or to strengthen his immunity with your remedies. So in that way also, you can maintain the exciting cause. Then suggest physiotherapy or massage if needed. In out of India, we usually suggest patients to visit chiropractitioner just to fix any deformity in the bone or any dislocation of the bone. Go back to the originally selected remedy after removal of obstacle to recovery. It is very important part because you see many of the doctors, they start the remedy, they remove the obstacle and they forget to repeat the original remedy. In that way, you are not saving the changes which you made in your patient. You see in laptop, we press Ctrl S to save the changes. Repeating the original remedy or deep antisoric remedy or any deep antimiasmatic remedy or the constitutional remedy of the patient in high potency at the end of the case is always works as Ctrl S, saving your file, saving the changes which you made in your patient. So this is all for today's session. I am so happy that with some technical issues also, you supported me, being a wonderful audience. And thank you so much for the interaction. These are my books available on my website also. You can write me even for if you want my books. And these books are available on Amazon too. This is Healing Woman with Homeopathy. Obviously, B. Jain published it. So, and our today's platform is Homeopathy 360. That is again B. Jain's platform. I'm really thankful, B. Jain, for everything. Special thanks to my today's host, Dr. Mansi, and a big thank you to the B. Jain's owner, Mr. Manish Jain. He's so friendly. I met him Greece also. We keep on meeting each other in India in almost every conference. Thank you so much, Bijan, for hosting me and for publishing my book. Thank you so much, everyone, for your patience listening. This is my email ID, my website. Yes, I do monitor the cases also. If you have any issues, you can write me the case on my email ID. These are my clinic helpline number. You can contact them. Thank you so much for being patient, audience. If you have any question, please open your microphone and talk to me. I'm just
Thank you.
answering.
Thank you so much, ma'am, for this wonderful session. This session was full of knowledge. And today I hope everyone learned a lot. If anyone has any inquiry or any doubts, they can put their question in question and answer box.
Dr. Amita Chawla, there is a question about Wi-Fi remedy. I already explained during my session that it is available with Helios Company, London. And Aditya Raj, your question is what is sepia? Sepia is very duty-prone person. We discuss sepia as a differential diagnosis of aurament. Yes, anyone else? Here, Mansi, can I take your leave now?
Yes, ma'am. I think it's time to wrap up.
Yes, but there is a question. Let me answer her. Aditi Shah asked that can you repeat remedy for addiction to screen? Aditi, these three remedies are silicia, fufurana, sulfur, and acid salt. I repeat, silicia, fufurana, sulfur, acid salt. So let us wind up now.
Yes, ma'am. So that's all for today. Thank you, everybody, for joining us. And thank you, Dr. Ma'am.
You are most
Thank
welcome.
you.
Thank you. Bye.
Okay, ma'am.
Good night. Good night.
Good night, ma'am.